Hey, I'm Marcy from brainandspinalcord.org. Let's talk about how family, friends, and loved ones can cope with potential personality changes in brain injury survivors. Be sure to check the website for all relevant links and a recap of this article. The survivor of a brain injury can face many challenges and changes. These challenges and changes can be cognitive, physical, or related to the senses. But while these changes can pose difficulty for both the survivor and his or her loved ones, the challenges and changes that are frequently the most difficult to deal with are those that relate to the personality of the survivor. When does a brain injury survivor experience personality changes? Well, there's no good answer to that question. It depends upon the location of the brain injury as well as the severity of the injury. Some personality changes are short-term, while others persist. Personality issues following a traumatic brain injury might include things like impulsive behavior, explosive anger, frequent mood swings, poor concentration, apathy and lethargy, or lack of emotion. A person who used to be calm and serene may suddenly appear explosive and angry, while an individual previously known for their high energy and ability to juggle a multitude of tasks may seem lethargic and apathetic. A person who used to be very helpful may be combative, while someone who used to be soft-spoken can be abrasive and harsh. Other times, the survivor's personality may be an intensified version of what it was before the injury. If you are a friend or loved one of a brain injury survivor, you know how difficult these personality changes can be. Not only are they perplexing to the survivor, but friends and loved ones are left wondering if the person they used to know and love is gone forever. Friends and loved ones can also feel anger towards the survivor when difficult behaviors arise, as well as sadness because they miss the person the survivor used to be. Friends and loved ones should keep in mind that even survivors with a good prognosis will most likely go through some personality changes on the road to recovery. Patience and understanding is needed, as well as a good dose of support. The best way to support a brain injury survivor experiencing personality changes is not to criticize new behaviors or emotions, or compare the personality of the survivor after the brain injury to the personality of the survivor before the injury. It's important that family and friends don't take the negative emotions or inappropriate behaviors of the survivor personally. While it may be tempting to distance yourself from the survivor until he or she returns to normal, remember that the survivor needs your care and understanding now more than ever. Help ease the frustration of the survivor by validating emotions instead of dismissing them, and instead of showing anger, show extra affection. In some cases, behavioral rehabilitation will be necessary to help the survivor cope with personality changes that result from brain injury. It's best for family and other loved ones to get involved so they are aware of and know how to use prescribed strategies. This concludes our segment on how family, friends, and loved ones can cope with personality changes in a brain injury survivor. Remember to check our website for the most up-to-date information, including resources and tips regarding brain and spinal cord injuries. And thanks again for watching.